Okay. So 211 is part of the national N11 dialing array. And it's interesting because 988 is a more recent three digits, the most recent three-digit dialing code, but often 988 is more well known than 211. And that's because there's a significant federal investment in 988, federal and state investment. 211 has been available to communities since the early 2000s, here in Wisconsin since 2003, 2004. However, there's no federal investment, so it's supported by local communities and in a large part by United Ways. So it's really kind of a different way that it's financed, but it is still part of the three-digit dialing code, similar to 911 or 988. This graphic people really like because it helps the distinctness between the three-digit dialing codes that and these three systems that work together. So 211 is primarily for three things. One, connecting people to community services in the realm of basic needs, mental health support, substance use supports every day. Connecting people to services and resources during a disaster or public health emergency, and then helping to connect people to volunteer opportunities if they're interested in looking for organizations to volunteer with. So those are the three kind of parameters that were given to 211 as a dialing code nationwide. So in the US, the 211 exists in the US and Canada. In the US, 99% of zip codes communities are covered by a 211 contact center. In Wisconsin, 100% of the state is covered. As you'll see here, there are 8 regional contact centers that operate their region. The gray area is our balance of state, which means when the regional contact center that used to be housed in Marinette closed because of just it was hard to keep a bricks and mortar service up and going. The rest of the state took on the services for those counties, and your county is one of those counties. And so that creates some imperatives that we partner with communities to make sure people know about 211 because there's not a bricks and mortar organization that's funded to provide that regional service. So the phones are covered by the entire 211 state system. So anybody that calls from your area is going to get connected 24/7 to a community resource specialist. The directory is curated in partnership between people on our staff, the regional contact centers, and most importantly, communities that are letting us know what services are available in the community. Partnership and how people know about 211 comes down to the statewide marketing or local awareness of 211 as a service. So again, 211 is really a partnership with communities, state, regional, and local. To give you a glance at 211 and the types of calls coming into 211 at a very high level, you can see the numbers here. I won't repeat everything on the slide, but we consistently see that housing, mental health, and food are in the top 3 reported needs coming in from community members. Sometimes, depending on what's going on in communities, we'll see a different order of kind of the the frequency of web searches on certain domains versus calls coming into the contact center. In 2024, they looked very similar. 211 is available through dialing the 211 dialing code or a 10-digit phone number. Some of the internet phone providers are still kind of working on getting all the 3-digit dialing codes operating as efficiently as they should. And so there is a 10-digit number to call as well. There's text service. You can search on the website, of course. And then there is a web-based chat service, which isn't used as frequently as it would have been 5 or 6 years ago. There's also a 211 app that's now available and can be downloaded through the Apple Store or Android store that also connects to the directory. So I want to talk a little bit about, we collect all of this information and it's available to you through a public dashboard. And I want to talk a little bit about what we've seen over the years in Shawano County. So I'm going to first just show you how to navigate it to get to the dashboard. And then I thought it was easier than just showing slides. So if you go to the About area on the website and Social Determinant of Health dashboard, you will see the dashboard. We'll see how fast my internet is here and rendering this. You'll see the dashboard collects information since when we started collecting information in our current platform, which was in 2018. And you can see that there was 1.8 million encounters since 2018 through 211. If you navigate to your county and click on your county, it will drill down to the number of encounters in that period in your county. So 2,700 encounters, not a ton over this period of time, but there are definitely people calling from Shawano County seeking services. And so I think it still provides good information. So we're now going to look at the dashboard filter through the eyes of callers from Shawano County. And we could do this. I know some of you represent other counties. We could, select one or more of those counties and see kind of the same things. So the first thing you're going to see here, first of all, on the left, there's lots of different ways you can sort or filter this down. I'm going to focus, though, on kind of the data and what you're seeing. So you'll see the top 5 request domains. Housing in Shawano County was the number 1 domain. And if you click into that, you can see what about housing were people calling for. So in some counties, when we click into the domain, we'll see that community shelters was the driving call. In Shawano, we see that rent payment assistance is the thing people are looking for the most when they call for housing. And then homeless motel vouchers, et cetera. And you can do that by drilling down to any domain. If you look at this information by year, so you'll see the second largest domain was healthcare in the overall period of time. But if we look at, if we look at just 2024, you can see that it was housing and then utility assistance, really kind of those household budget items that people are looking to find supports to be able to manage their expenses in a way that can sustain their family. I'm going to go back and look at the trends for the entire period because I want to show you some trends as well. Okay, when you scroll down in the dashboard, you can see we actually collect information and report to this dashboard daily. And so you can see the ebbs and flows and calls to 211. You can, I can tell you there was some flooding happening. I can just see it because of the spike. So the governor probably said, call 211 to report your damage or a disaster because we are utilized for public information during disasters. You can see all the activity during the pandemic in 2020 and what was happening. And then you can see your more recent activity. We then look at it through various domains. And what we're demonstrating on this website is looking at health and clinical care, mental health, substance use, because we do operate the Wisconsin Addiction Recovery Helpline, and then into your social determinant domains of housing, hunger, income, et cetera. You can see the daily activity and also kind of the trends by year and what's happening in your county. So a couple of ways that community partners use the dashboard is to help substantiate what you know. You know the things your community members are looking for because you work with them every day. But many organizations use the 211 dashboard to help substantiate that in grants and other ways to identify kind of like this information coming in to help support the work you're trying to do. One last thing I want to point out is at the bottom of the dashboard, we do make follow-up calls, and we collect information about whether services were provided or not. The degree in which we do this community by community is based on those community partnerships. So it's really important that communities are engaged with us so we can increase the collection of this information. So we can tell here just real quick, and then we'll move on, that the number one reason for a need not being met through a service provider is that there was no program availability. Again, probably not surprising to you. You know, services are limited in your area, but again, it helps to substantiate that is the reason why the number one reason why people report they were not able to get access to that service. So hopefully that's helpful in just understanding currently how your community, Shawano County, is utilizing 211. So I want to go and talk a little bit more about how to navigate 211, and then I'll pause and we can see if there's any questions before I move further. So people are familiar with 211 based on how they hear about 211. And we typically see communities focusing on one or more kind of lanes of communication about 211. The first and primary lane is through just making sure there's members of the community understand that 211 is a place you can call to find out what food, clothing, transportation resources exist in the community. And we refer to that as kind of human needs and social determinants. There are some communities like in La Crosse area where they're really focused on mental health supports and substance use recovery supports. And so that's what they're communicating into the public. And so sometimes we see more calls coming in for those domains because that's what they're talking about in their community. Employment support similarly, and again, then specific populations. And then during those times of disasters, whatever the disaster type is, we'll see kind of spikes in the data coming through from that viewpoint. So really, the way your community members know about 211 is based on how you're talking about 211. From a 211 Wisconsin perspective, we provide general information out to the public related to 211 proper, but then also the Wisconsin Addiction Recovery Helpline, and then some of our special projects like getting connected to internet assistance and device distribution, things like that you know us for. Just briefly, the Wisconsin Addiction Recovery Helpline, we will be providing that service for at least an additional 5 years. And we see, again, kind of some trends in terms of what people are calling for there as well. And so that might be of interest because I know you guys have really been focusing on that gap of recovery services in your community. And if that's of interest, we can talk more about that and how to partner there. So again, just to recap, you can access 211 by calling through the website, through the app, or through text and chat. It is available to everyone in your community. It's just whether they know about it or not, and whether, as we go into the directory, there's the completeness of what you want to see in the directory in a way that your community members can understand it. So I'm going to pause and see if there are any questions before talking about kind of navigating 211. Okay. I'm going to just check the chat here.
Officer Shane had to take off. So I just want to reiterate kind of what Charlene is saying here, right? If you could envision, Tiffany, I know you work a lot with young families at Theta Care. So your organizations are going to be a lot more client facing, community facing than sometimes our United Way is. And so this is why doing this training is so important. I think about Captain Shane and the police officers. A lot of times I think that what's happening is they'll bring them to San 25 for community resources, which is great. Chris does a phenomenal job. Chris is also just one person. And so, ways that we as a community could better utilize this resource throughout the county, to not put the workload of all of Shawano County on Chris or on our partners at St.
Showing.
So this is part of why we organized this training today. Just to start getting people to think about this as a resource that you can utilize.
Great, thank you, Uriah. Okay, I'm going to talk a little bit more about navigating 211. So we've been making some changes to our website, but I first want to just talk about what happens when somebody calls 211. So really high level, somebody has a need. They call into 211 and they reach one of the community resource specialists that's available 24/7, that they live in the state, work in the state, but of course, there's not somebody that is deeply understands every community service in every community. So they rely on this resource directory as well. But they are available, they understand Wisconsin, they understand Wisconsin programs and the way Wisconsin programs are funded. They work with the community member to understand their needs again, they might be presenting with needing food, but they might also have been recently unemployed. And so they can also address that need, which is more difficult to address through the website, right? So they're able through motivational interviewing to kind of talk and get to maybe some of those other needs. It's all based on what the caller is wanting to talk about. So they certainly don't pressure the caller on those things, but they develop rapport to try to get to as many of the needs that a caller may have in that one session. The community resource specialist then makes referrals out to the community. They each, depending on the relationship with the programs in the community resource specialist makes a traditional referral that could be emailed or texted to, they certainly give it over the phone, but they can send it through email or text to the community member. But sometimes there are partnerships where the CRS, because there's already a partnership, makes a warm transfer to that agency or makes an electronic referral to that agency. So those are all things that are possible. It just depends on the community partnerships and what's agreed upon. We don't assume that a community agency wants to receive an electronic referral. So if there's a partnership, the community resource specialist sees that and they will make that electronic referral in addition to providing the referral to the community member. The community resource specialists follow Inform USA standards. So that's the same accreditation body that ADRCs and crisis centers use for certification, training, and accreditation of their centers. They go through a assessment process, understand needs, brief intervention, make referrals or warm transfers. Before they disconnect, they want to make sure the community member knows what their next steps are, and then they will ask for consent to follow up. Because again, everything from 211 is based on community member consent and what they want. They're in control of the conversation. We consider that to be our horizontal workflow. But in order for that community resource specialist to know and have the most complete understanding of community resources, it takes a team, an army, to make sure these community resources are accurately portrayed in the directory. And so that's where we also can use community support. So the 8 regional contact centers curate and create partnerships with different organizations in their community. 211 Wisconsin is working in your area, the northeastern Wisconsin area. And part of the success is partnerships and building that rapport and trust between organizations so that the information in the directory is the most accurate current information for your community members. The community resource specialists are also trained using Inform USA standards. They work on partnership development, understanding if agencies want to have electronic referrals, all of those sorts of things. They organize the directory in a very specific way, and which follows the accreditation standards, because it needs to be consistent so that anybody around the state or country can actually use it and pull back information based on the context. And so our community resource specialists don't just decide how to structure the directory. It's done in a very specific way in order to meet the standards of the accreditation body and also maintain consistency. That's considered to be the vertical workflow. So I want to talk about how to navigate the 211 website as well. So I'm going to flip back up to the website and go back to, sorry, let me scroll up here and get back to the homepage of the 211 site. So when you first come to 211wisconsin.org, you are asked for your zip code. Once a zip code is entered, it will stay through that entire session of navigating the 211 directory. If you enter your information, I believe 54166 is your area, or at least a part of your area, and then we can search the directory. That zip code will hold, and we can then look at all the various domains and the types of services that are available through 211. So for example, if I'm looking for food, I could go and get specific information about WIC in your area, or maybe a food pantry. So I'm selecting a food pantry. The directory filters information based on the closest information to that zip code. So you'll tell me, and I usually hear if this is not correct, but there is a food pantry offered by the Shawano Area Food Pantry and Resource Center that is available to your community. The listing includes a brief summary of what's available at that agency or for that service, how to apply, the hours that you can do that, basic eligibility, the area it serves, and then there's more information that's available. These codes are to our specific coding so that when we're sharing information with ThedaCare, which we do, that they can match it up with the Epic code that's the same correlation. So those codes are very specific in terms of how we curate because we share information with various partners. And I'll talk about that at the end. You don't have to worry about understanding codes because the site is, we're trying to make the site as user friendly as possible. So you don't need to understand taxonomy and coding, but it is important for us. Any additional information about that service, you can from the website then add the resource to a list. You can share it through text or email with yourself or someone else. You could print the resource. You could also, if you've selected multiple services, you can print the resource list, and then you can go to that agency's website. On the left of the site, there are additional filters if you need to filter down in for other variables. The numbers here to the right are representative of all of the services that are in the directory. If you haven't told us as a service provider what ages you serve or the days of the week that service is provided, et cetera, then if somebody filters on it, they're not going to find it because we only can do our job in the best way we can as long as we have the information that's most accurate. And this is why sometimes our people on our team are maybe trying to call you and figure out, we want to make sure we understand this so that we can provide the most information possible to the community. You can get into the record to a greater degree if you have additional questions. Not a lot of people use this part of the service, but you can. So I'm just going to show you. There's the complete record that's available. And also, if Shawano Area Food Pantry had multiple site locations or additional services that they provided, you would see them on the left here of the screen. Are there questions about how to navigate the 211 directory at this point? Okay, so I want to show you there's a couple of other things on the website I want you to be familiar with. One, we do also provide targeted search categories. Those targeted search categories are based on state partnerships or sometimes local partnerships that we have. So the basic needs guided search, which is the first way of navigating the directory, is what we default to. That's normally the page that organizations point to if you're going to put 211 on your website for people to be able to get to the directory right away from your website, which you can do anytime you want. But if you're looking for maybe how would somebody who is really looking for resources for families and children, you might want to use the family and child guided search where we've partnered with the Prevention Board and Family Resource Centers. And when this search was created, it was created based on advice and conversations with Family Resource Centers and how they most frequently want to look for services. So you don't have to use 211 just the way we've thought about this broad set of services. The directory can be organized through these search interfaces to navigate the way others might want to navigate the directory, and also sometimes the language and words that we use. This has been branded with First Five for Families and the Prevention Board so that they can point to it from their website and it feels more connected versus coming into our kind of brighter, harsher colors that 211 uses. I shouldn't say harsh, the bright and fun. Those are the colors that we have. So I want to say just a bit about calling 211 during a disaster. because this is something that 211 does, and also an important reason to develop some partnerships. So we know that if there was something happening in your community, how to best partner with emergency management that serves your community and others that are really active during those incidents. So, first of all, we partner with Wisconsin Emergency Management and we partner with Public Health Emergency Preparedness from DHS. And we are partnered. This slide's kind of a little interesting to look at. So let me explain it a little bit. So we use 211 at Wisconsin Emergency Management and Public Health Emergency Planning use 211 so that there's one number to put out into the community if they need to provide some public awareness outside of the normal DHS or WIM channels, because they obviously are going to use their own channels, but they use 211 as a public information source. So they use 211 to connect people to services and those imminent services. So during a flooding disaster, things are changing rapidly. Our team is updating our website with information about what's happening in local communities very quickly. And so again, what will happen is somebody usually from the county will call 211, say we need to activate, there's some flooding or there's wind damage or whatever it is. And we ask for at least an hour if we can, but there's, times where we've not had that much time to just get our system set so we know those calls are going to come in. We can put something at the beginning of our when somebody calls 211, so if you're calling about the Shawano County flooding, then it takes you immediately off into call specialists that are familiar with that event. And then the rest of the navigation would happen for the rest of the state. We also use 211 in those situations for situational awareness. Sometimes the county or governor will say call 211 to report your damage. That is so that Wisconsin Emergency Management has is been able to monitor what is the extent of the damage, so emergency managers can go out and do their formal assessment. But we're reporting that information very frequently, every 15 minutes into the State Emergency Operations Center. And then, of course, we partner with Wisconsin VOAD, which is Volunteer Organizations Active in Disaster. And oftentimes, VOAD will send volunteers out to help with cleanup and other things that are needed in the community. And so when somebody calls 211 during a disaster, we're asking them, again, for permission. Can somebody follow up with you if there's volunteers available in your area to help with cleanup? And so we're managing all of those different connection points. Our objectives during a disaster are to disseminate accurate and up-to-date information to the public. Again, that requires local partnerships to do so well. We manage non-emergency calls during emergencies and disasters so that emergency services are more available for what they are needed for. We provide community resources and information referrals. We gather preliminary damage assessments, and then we collect cleanup assistance requests and coordinate volunteer deployment. So that's just to summarize all those kind of objectives that 211 regional contact centers in our state office have during a disaster or public health emergency. Okay, I already showed you a little bit about navigating the 211 website, so I want to move to strengthening their community resource directory. First, I want to pause again for any questions. Okay. So I'm going to give you a little bit of an overview of the directory. It is very large. The database includes more than 20,000 agency locations and 30,000 services, but it's growing all the time, and those services change all the time. We have a pretty big team that not full-time equivalents, but people throughout the state that are working to either collect information through maybe somebody's call, so they can make those changes, gets reported from the public, and best case scenario from agencies themselves, and that their work is to keep the service directory as up to date as possible. It is a big job because there are lots and lots of services and lots of moving parts. Our database, as I said earlier, is maintained using national standards. I think this is actually an older snapshot of the types of services in the directory, but it just gives you um, idea of the number of services at the service level that are in the directory and types of things that can be found there. Validated, which means it's locally verified and it's routinely verified. So sometimes people say, well, you only update your directory once a year. That's not true. We update the directory every time we have additional information, but somebody is in charge of going through and validating that the information is true at least once a year, if not more often. So that means they go through and try to get connected to that agency, understand the services, make sure we've listed them correctly, and they go through that whole process at least once a year. Best case scenario, the regular communication about things that have changed throughout the year. If we're unable to verify that a service exists, after a certain amount of time, we have to deactivate the service because the community resource specialists in the call center need to know that if they're making a referral, they're making a good referral. And if somebody's searching on the website, we need to know that they're actually getting good information. And so that back and forth communication is also very important so we can verify. Sometimes people will ask us just to go look at a website. I don't know how much resource you have to keeping your websites up to date all the time. We don't have a ton on our general agency. That's the thing that gets probably least prioritized on our general United Way of Wisconsin website. And so we know that agency websites, while they're good information, they're not always the most accurate information. So we are a little pesky about that, and I'll apologize, but not really, because we need the information. It's vetted to make sure the services are included or fall within the inclusion policies, which are posted on the site. So there are services that are not included. Private entities that pay large amount that require large, fees are not included in the directory because the directory is free and low cost sliding scale services that the community needs. We also make sure that it's vetted so that it's not a bad actor trying to get in the directory to get referrals that might do harm. So those things are all really important to us. And then we also follow whatever community governed processes and partnerships that are in place. And then it's comprehensive. We collect lots of different elements, and then we have lots of years of experience doing this work. So what differentiates communities that are using 211 and feel that that's a robust relationship, and those communities that feel like 211 isn't as present as maybe they would like, present as they would like in their community, are these things. So the first thing is partnerships with communities where communities are investing time, talent, treasure, right? So you don't always have a lot of money or financial resources to help fund 211, but you do know what's going on in your community, and that is very valuable to us. So the partnerships where we can make the work our team has to do to understand those services actually make it more cost effective for everyone to maintain 211. So communities that are committed to doing that have a better experience. That where there's communities where there's stakeholders that help to identify new and missing services. So many of our local United Ways help with this. They'll help us know when there's a new service or if they're funding a new partner or something's changed. But other organizations in the community helps us to do that too. For some of you, you have like central organizations that may help us understand the entire network of services. Also, when agencies proactively update your profiles, that's really helpful to us. And I'm going to show you how to do that. And then where we have partners that promote 211 beyond just our state promotion, because it makes it more local. And the more 211 is trusted in the community, the more people use it, and just the whole cycle improves. Pause, make sure there's no questions. And I'm going to go into updating. How do you update the directory? Okay. First thing that's going to happen if your agency's in the directory, there's a person identified from your agency that receives the annual update email. It looks something like this. This is a pretty big, this was the Greater Wisconsin Aging Agency on Aging Resources. Emily just sent me a more recent solicitation that went out so I could see it to show you. Every link is a different service and level of the record, where when you click on the link, you get access to then update that service or if there's anything that's changed in that service. Anytime you update something, it goes into the resource managers where they can go in, make sure that the person that suggested the update actually was the person that should be submitting the update. And from these emails, they then will maybe make a phone call to you, et cetera, to verify that they understand the information you're providing. So this happens once a year, in some partnerships more than once a year. But it's our way of pushing out requests for updates. The second way is to find your profile through the 211 Partner Hub, and I'm going to show you how that works. And I'm going to do this fairly quickly because I know we're running a bit short on time. So you go to the Partner Hub up here at the top of the website, and you can either go to search and update your listing, or you can go to get listed. Either way, I have that already up here, so I'm going to just go and do one. You would go into the agency search and add your agency. You can either add it if you the system when you add it in. Did you know that? That second question? Do you know your 211 agency organization name? It has to be listed exactly the way it's listed in the directory. So if it needs to be changed, you got to list it exactly. So it's better to go into this quick keyword search because it pulls back more records. This example is looking at Shawano County Human Services Aging Unit. You can see all the different services that are curated for aging, and then you would click into one of those services. It's going to send an email to you when you come down to submit a revision request. So you find your service, submit a revision request, put in your information. It will send you a link. That link allows you to go in and suggest literal changes to the record. Before those changes are accepted, they come into the 211 manager, again, to make sure that it was a legitimate request and there's no questions. And then they're accepted and then published right away to your listing. Any questions about that process? It's pretty seamless. Sometimes, though, organizations are like, that's a lot of link. Aging has lots of services. And so another way is you can call someone at 211 and they will help you update your listing. Because sometimes going through the links, you don't have time for that. So talking with somebody on the phone to do that, they're more than willing to do that with you as well. You can also add an agency site or service by going to that same place in the Partner Hub and saying, get listed. We don't ask all the questions that are in the profile, but we want to ask enough to make sure we understand and can check to make sure that your agency is not already in the directory. And then we will reach out to you to continue and fill out the profile. Any questions about that, Uriah? Is that what you were looking for us to do there to show how to update the records?
Right. And so, we run the local community resource card at our local United Way level, uh, which I know 211 has used in the past to update records, but kind of like Charlene said, I'm the only employee for our United Way. So I only update that once every 6 months. So if we could, as a community, be better about keeping this resource, the 211 resource, the most up to date by being proactive in our own agency updates, it's going to better service all the clients, community members throughout Shawano County and the Menominee Reservation. So that was really one of my highlights of getting Charlene here today was to help you all see what that looks like.
Okay. So I want to also share with you who else is using this information because it's also really important to keep the directory updated if it's even just for these reasons. Um, we share the entire directory with 988. So when somebody calls 988 and they're so 988 is trying to resolve people's needs. Now it's Suicide Lifeline Crisis Center, that's their purpose. But if somebody calls and their stress is related to a food pantry, 988 wants to be able to give somebody some resources around food pantries or around community mental health or other services that are available in the community, in addition to what 988 does, which is to de-escalate that suicidal situation. So our directory updates inside their platform. They're not even searching on our directory for it. It goes right into the 988 platform, like every 15 minutes. When information is updated in our directory, it immediately is going into 988. It is also going into job centers and through the Wisconsin Job Center. Where you search for jobs, there's a widget where you can search for community resources as well. So our data goes in there. We also, the Family Resource Guided Search, Family Resource Centers use that page to identify resources. We have some partnerships with some health partners where when we're updating, they're taking usually not, it's not daily, weekly, if not monthly updates to the resource directory. So clinicians have access to that information. And then we have several special projects as well. I know you guys had created a community-wide resource directory. It is possible, similar to that example I gave you from the prevention board, it is possible to have your own branded Shawano only resources available through whatever public site you want using this directory. So that is very possible. You don't have to present it as this entire state directory. It is very possible for us to make those very local, access to the directory. And there's examples around the state of where communities have done that as well, or agencies have done that, because it's just a better use of resources to build on something that exists than to try to recreate the entire process, which is very time consuming. So I just wanted to make sure you were aware of that as well. And with that, happy to answer any other questions or take feedback on anything that's like, well, that's not what happens when I call, or any feedback. You're not going to hurt my feelings, and I'm here for you. So what other questions do you have? Any feedback?
No questions, but thanks, Charlene. That was really comprehensive, and it, it really is impressive too. I'm excited to promote it.
Thank you. If there's ways to make it easier, we want to hear that too. Um,
So I'll build off of Chris's comments too. Just a vision for this community, right? Some of what we're doing at our local United Way level is we're looking at some of our 211 data to start establishing what is going to be our strategic plan, right? So if we see that rental assistance year after year continues to be an issue, then what are we going to do with our local United Way, leveraging our resources to better meet those needs? Uh, and so I would imagine, public health could use that as part of the community health assessment, especially since it's broken down in the social determinants of health. And the more data that we get, right? So the more people that are utilizing this resource, the better and more accurate that data is for a full picture, an accurate picture of what our community actually needs. So just something for us to think about too. The other thing that just blew me away when I met with she's no longer around. I met her like 2 weeks out before she left, but the program supervisor for 211 was the disaster management side. I believe Oconto County had just used this past winter when they had all those power outages.
mhm.
You could call 211 to learn about where the nearest warming shelter was. Where do you go get food and water? And the other thing that just made me think of was, last summer when the Manawa Dam
Oh
went
yeah,
out.
yeah.
We have waterways around here that can be unpredictable at times. And so it could be a really interesting partnership to better leverage from our government side at the local level as a disaster management, emergency management service. So trying to get those wheels in motion too. But this is just, I love this resource. I think it's a wonderful, wonderful thing, and we can do a better job of helping control it and utilizing it from the Shawano area. So,
I agree. I'm really glad that you did this because I'm giving out information for resources all day long. And I feel like I just got the gift of a tool, even though I have the brochure I'm sending out. Now I'm like, I want to go through this. I want to look this stuff up. I want to be able to say, hey, come on in, let's look this up.
yeah.
So thank you.
You're welcome. So there are some materials that you can order and we can send out to your community to help promote 211. They're general. So some communities want their own card in Spanish and Hmong and English for the Wisconsin Addiction Recovery Helpline and for 211 Wisconsin. So the Wisconsin Addiction Recovery Helpline's on one side, 211's on the other side. And then there are also little business card size, just cards that you can give to people to remember to call 211. So those can be ordered through our website. Or ask Uriah and we can coordinate getting some information. I don't know, Uriah, if you're coming to our summer meeting, we can bring some boxes to you to the summer meeting so they don't have to be mailed. But that information is paid through grants. So, definitely want to get it out to your community if that's helpful.
Well, I just wanted to piggyback. This is Rachel. Kind of what was said just now. I realize family services as a whole is in 211. But when I looked and searched up our home visitation, it's not in there. So that is a really good reminder too. I sent an email already to our people that like, hey, we should be in there under parenting resources.
Yeah.
So and that was super helpful. So thank you on that.
Yeah, thank you, Rachel. Great. Well, I'm here. If you need anything, have a great Friday and wonderful weekend.
Hi.
Oh, there's another question. Yeah.
Yep, I just wanted to ask something. My name is Ilya. I work for the Forward Service Corporation. I was previously covering Shawano and Menominee counties, and I'm just being transferred to Outagamie. But I do have a question. So every once in a while, I work with people that want to improve their resume, and one of the ways would be through volunteering. Is there any way for 211 to work with volunteers? Are there any updates that need to be done on the website, for example? Because I have a couple of recent graduates in different training programs in IT that could potentially work with it too. Is there anything that could be done? And I know I might be putting you on the spot, but if in the future the opportunities come up, it would be very good if some of the people that I'm working with could do something.
Yeah, so the volunteer opportunities that organizations might have are held in another site called Volunteer Wisconsin. And so you could list, that's where nonprofit organizations or others would be listing volunteer opportunities. If somebody a volunteer called 211 and was interested in knowing if there was something available to volunteer, it would be based on whether they know that volunteer opportunity exists. Otherwise, some organizations list their volunteer opportunities also within their service, if that's a service they provide, where they work with volunteers on certain projects, like IT projects and such. That could be a service that was listed under that organization. And so 211 would be able to find that. Nonprofits are less likely to list their volunteer needs on the 211 database. They can, but they usually don't do that to as great of efficacy. But on Volunteer Wisconsin, that certainly could be a resource. And then happy to talk with you. We do work with Forward Services Commission, FSC, it's not commission, I know that, to curate kind of the entire organization so that it's more consistent. So that's something we can look at too when we're working with whoever at headquarters that we partner with.
Ilya, I know you said you're transferring to Outagamie. At the local level for United Way, that is something that we are working on our website, kind of following with some of the United Ways in Minnesota that we had looked at we've been listing steadily volunteer opportunities. The chamber just partnered with us on that project, so we're the official volunteer opportunity provider for Shawano Country Chamber of Commerce as well. So you can find more of those, and we keep on growing. San 25 is listed, Safe Haven's listed, but Volunteer Wisconsin will eventually be what we try to move towards utilizing better in our area as well. I just personally felt like 211 was a higher priority project for us to look at.
Yeah, thank you.
Well, I got 11:59 by my watch. So just want to say thank you all for coming. We did record it, so I will find the best way to share this out, especially since we had some people that had to leave and come in. It'd probably be a YouTube link or something, a delisted YouTube link. But other than that, thank you all for coming. If you have questions, you all have my email now, so please feel free to reach out. I can connect you to Charlene if it's something that I don't know. But yeah, I look forward to seeing how our numbers will change on the tracker and providing the best resources that we can for communities in need throughout Shawano and Menominee counties. So thank you.
Thank
Thank you
you.
for letting me spend time with you. Take care.
Thank you.
Have a great day, everybody.
Thank you.